Nutrition during infancy. So when we speak about infancy, we're referring to the first 12 months of life. And the recommendation in the United States is that for the first 6 months of life, optimal nutrition would be to exclusively breastfeed a baby, or if you're unable to breastfeed, then to consider formula. Okay, we don't give anything except for breast milk or formula milk to children 0 to 6 months. Now from 6 months on, that's when the child starts eating solid foods. You usually introduce solid foods about 6 months. There's some babies who will show signs of being ready to eat by 5 months. But if you're at 3 months or 4 months, we know that that's definitely too early for the baby to start eating solid foods. What can happen is, oftentimes it can increase the risk of food allergies. If you're introducing solid food proteins to a baby who's not ready for it yet, the body can perceive those proteins as being antigens, bad guys, and it develops antibodies and thinks it's a foreign invader. So we know that higher rates of food allergies are linked with too early introduction to food. If you think about this environment that some parents live in that's hyper-competitive, you've all seen the commercials for my baby can read at however it's 9 months or whatever it is, or my baby can walk earlier than your baby. Okay, there's other parents who think, well, if my baby can eat earlier, then maybe that's a sign of development. And it's definitely not. You don't want to feed solid food until the baby is ready. So when it comes to the particulars of nutrition for the first year of life, the most important thing to remember is that the calorie needs for infants are astronomically high compared to their weight. You and I as adults, we need roughly, for every kilogram of body weight that we weigh, we need 25 calories. So if you figured your weight in kgs, which is your weight in pounds divided by 2.2, and you multiply that by 25, that's about how many calories you need. But if you look at a baby, you have to weigh or multiply their weight in kgs by 100 calories to meet their needs. Now, of course, a baby weighs a lot less kgs than you do, so the total net number of calories they need to eat is small compared to you. But compared to their body weight, they eat 100 calories per kg, whereas you only need 25. And that's because this first year of life is characterized by very rapid growth. You think about how the baby increases in size and length and everything else that's still forming. So the needs are actually quite high compared to their body weight. A couple of other nutrients of concern during the first 12 months. The first one is vitamin K. When we studied the fat-soluble vitamins, we mentioned that one of the roles of vitamin K is to promote coagulation of the blood. Right? The K stands for coagulation. That's the Danish way of spelling that word. Vitamin K was discovered by a Danish researcher. When you hear K, you should think coagulation. That makes your blood clot. We not only get vitamin K from dark green leafy vegetables, but also bacteria in your gut make vitamin K. Okay? When babies are born, they have a sterile gut, so they don't have bacteria, so they don't have the capacity to make vitamin K until after they've fed for a couple of hours. So what if in the very first few hours of life there was some horrible accident and the baby started bleeding? They would not have the ability to clot blood. And so that's why shortly after birth, in the developed world for the most part, we give a prophylactic dose, an injection of vitamin K to the baby. Okay, that's to give the baby the ability to clot blood before they get fed regularly and have their own bacteria in their gut. That's to prevent bleeding. Again, it's used prophylactically just in the outside chance if there was some sort of internal injury and bleeding, that kid would not bleed out. Next up is iron. Iron is transferred from the mother to the fetus at the tail end of pregnancy, where we said a full gestational period is 40 weeks. In most worlds, the medical team, if you go 38, 39, or 40 weeks, that's full term, somewhere between 38 and 40 weeks. But it's at the end of that gestational period when the mom transfers all the iron to the baby. So babies who are born prematurely, it's prior to 37 weeks, okay, they're considered to be at risk for iron deficiency anemia because they didn't get that nice transfer from their mom. Now, if you do go full term and the mom transfers the 6 months worth of iron to the baby at the end of pregnancy, that iron transfer lasts the baby up until from birth to 6 months. Basically, that big chunk of iron that the baby got at the end of pregnancy lasted up until the 6 months of life, which is good because as we've learned, breast milk is low in iron. Okay? If you had to pick two things that weren't perfect about breast milk, it's that it's low in iron, okay, and it's low in vitamin D. Low in iron doesn't really matter, because if you're exclusively breastfeeding for the first 6 months of life, who cares if the breast milk's low in iron if the baby got 6 months worth of iron stores from the mom at the end of pregnancy? But starting at about 6 months is when those iron stores begin to deplete. And that's why the very first food that we introduce to a baby is iron-fortified cereal. All the cereals that are baby cereals should be iron-fortified, because you're starting to feed these at 6 months, and that's when the baby's starting to run out of iron. We'll talk about why it's rice in a moment. Okay. The American Academy of Pediatrics recommends supplementing kids with iron from 6 months to 1 year. You learned about the two types of iron, heme iron and non-heme iron. Heme iron is much more well absorbed by the human body. But there's not a lot of red meat that 7-month-old kids are eating. Okay, so they need to get their iron from other sources. And iron-fortified cereals are a very good way to do that. Vitamin D is next. Okay, that's the other nutrient that breast milk is low in. If you were a formula manufacturing company, you might say, my product is superior to breast milk because it's iron-fortified and vitamin D-fortified. And that's technically true. They can add more nutrients into formula that you can't add into breast milk. But remember, with formula, you never get those antibodies, okay, and those bioactive factors that promote immunity and all the other health benefits. You can't replicate those in formula. So we still say that breast milk is nutritionally superior, even though it's low in iron and low in vitamin D. A mom's level of vitamin D affects the vitamin D status of her breast milk. Remember, most adults in this country are deficient in vitamin D. We don't sit out in the sun for long periods of time, and we don't drink equivalent of 3 or 4 cups of milk a day. So most adults should be supplementing with vitamin D. But also in 2008, the American Academy of Pediatrics said that all kids should be supplemented with 400 IUs of vitamin D a day. If you're drinking cow's milk, kids who are age 1 and older can drink cow's milk. A cup of milk has 100 IUs. So if a kid is drinking 4 cups of milk, then yeah, he or she's getting 400 IUs. But from 0 to 12 months, you can't feed kids cow's milk. Okay? Their digestive system is not ready for it yet. So what do? You have to supplement. You can either give your kid fortified formula, but if you're breastfeeding, you're not giving formula. If you're breastfeeding, you have to supplement and give the kids, you can get little drops of vitamin D, and they just drop them on the baby's tongue. And that way, every day or every week, you can give your baby enough vitamin D. It's very important that parents check with their pediatricians, though, for the recommended dose. And oftentimes, the mom will have her vitamin D levels tested, and they can figure out basically how much should you be giving your kid. But you also have to be very careful, because if you accidentally give 10 times as many drops as you should, vitamin D is a fat-soluble vitamin. Remember, in excess, it can build up to toxic levels. So you want to be really careful that parents understand exactly how much of the supplement to give. They don't overdo it. Remember, children who are deficient in vitamin D are at risk for developing rickets. That's the condition where the legs bow out as they start to walk, because the growing weight of their body cannot be supported by their weak leg bones. Fluoride is the last micronutrient that's mentioned on this slide. We learned when we studied minerals that the primary source of fluoride is fluoridated water, if you live in an area where the municipal water supply is fluoridated, and then also fluoridated toothpaste. If for whatever reason the kid has no fluoride from the toothpaste, no fluoride from the water, then the pediatrician may recommend fluoride supplements. This slide is rather busy, but it has a couple of just basic tips about what you do and don't do regarding feeding kids in the first year of life. And we're going to start with cow's milk. As I mentioned a moment ago, cow's milk is not appropriate for children under the age of 12 months. Okay? If you don't have formula and you don't have breast milk, okay, sometimes in the developing world they will give kids cow's milk. But here in the United States, we have plenty of resources and there's lots of ways parents can get formula. Kids are not anatomically ready to digest cow's milk. Okay? Their gut and their kidneys cannot handle the high protein load. We looked at a comparison when we studied breastfeeding about how cow's milk is just too high in protein. 20% of the calories from cow's milk come from protein. In breast milk, only 6% of the calories come from protein. Breast milk and formula are real low in protein because the kidneys are not developed enough to handle that. If you recall from our studies about protein, Protein is the only macronutrient that contains nitrogen. And nitrogen is a waste product that becomes part of your urea. Okay, and your kidneys have to process that. So you can't go blow out a little kid's kidneys with a ton of protein from cow's milk. When it comes to lower reduced fat milk products, kids age 1 to 2 should always have whole milk. Okay, so if you have an 18-month-old, that's a kid who's a year and a half, that kid should be drinking whole milk. They need the fat for brain development. Okay, make a note of that. That's a very important link there. The fat in whole milk helps with brain development from ages 1 to 2. But starting at age 2 and on, children should not have whole milk. That's when we should introduce reduced fat, low fat, or non-fat milk products. For 2 reasons. Number 1, the kid has plenty of other sources of fat in the diet. By the time they're 2, they're eating pretty much the same foods that adults are. They're not just getting fat from milk like they were in the second year of life. But secondly, you don't want kids to get accustomed to having the high-fat whole milk. Okay, it's nice and creamy and thick. If you get hooked on that, there's no way those kids are going to go to low fat or reduced fat when they're older. The reality is many kids in this country are at risk for overweight or obesity. We don't need to be bulking them up on full-fat milk after age 2. The exception to that rule is if your kid is underweight, then you keep giving whole milk because they need the extra calories. So again, to reiterate, from age 1 to 2, it's okay you should be feeding cow's milk because the kid's off of formula and usually off of breast milk by then. From age 1 to 2, whole milk is appropriate and should be given for brain development. But starting at age 2 and on, all kids should be on reduced fat or low fat milk products. Remember, they're just as nutritionally dense as all of the other whole milk ones. It's just that they contain less fat and saturated fat.
Would it be good to feed your kid breast milk or something to supplement with it?
So the question is, would it be good to feed your kid breast milk and then supplement with it? It's the choice of the mother. If she chooses and wants to breastfeed beyond 6 months, if she continues to breastfeed regularly, she will continue to make milk. Okay, and so she can choose to supplement that in if she wants to. But if she's one of those moms that's done at 6 months, well, what's the kid going to drink from 6 months until 2 years? Okay, or sorry, from 6 months until 12 months, you usually have a little bit of milk or formula, breast milk or formula, but you don't introduce cow's milk until after 12 months. And if you're still doing breast milk after 12 months, you can intersperse it with formula, certainly. In this country, you tend not to see kids over age 1 breastfeeding. If you travel and live in the developing world, it's not surprising at all to see children 2, 3, 4 years old breastfeeding. Okay? If you think about what the alternative is, we wean kids off of breast milk here. We've got plenty of healthy foods to feed them. If you live in Bangladesh, you wean your kid off of breast milk. You've got rice, okay? And that's not nutritionally dense at all. So the longer you can keep some breast milk in the system, the better it is for the baby.
When you say after 12 months, does that mean 13 months or 12 months?
After 12 months, it's usually by the question is if at 12 months you make the change. It's usually by the kid's first birthday, then it's okay to introduce cow's milk. Okay? And some kids will have digestive problems with cow's milk, and some kids will have milk allergies, etc. But that represents just a small percentage of all children. Okay? The next up on the list is honey. Okay? Honey is okay to give to kids age 1 and over, because by the time they've hit 12 months or age 1, their immune system is developed enough to handle. Okay? And the issue here is that under age 1, honey, this is raw honey, okay, not honey-flavored things, not Honey Nut Cheerios, which has no honey in it. But we don't give honey to kids under 1 because there's a risk of botulism. Okay? Botulism is a neurotoxin. We'll learn about it when we study food safety. But basically, if you and I as adults have honey, we can handle the very small amount of spores that may be potentially botulism-inducing. But a very small baby under age 1 could be at risk for developing botulism if they're given honey. So we don't give honey to kids under age 1. When it comes to cereal, as I mentioned before, the first cereal that you feed is iron-fortified rice cereal. Iron-fortified because it's at 6 months when you usually start introducing solid foods, and that's the period where those kids' iron reserves are depleted. The reason why it's rice is because rice is the least allergenic of the grains. Okay, you are hard-pressed to find someone who's allergic to rice. Wheat, yes. Okay, other types of grains, maybe. But rice is very hypoallergenic. When you introduce new foods to babies, the recommendation is not to introduce more than 1 new food at a time. Because let's say one day you throw 5 new foods at a baby, and later that day the kid breaks out in hives. How do you know if it was the strawberries or the wheat or the new type of peas that you tried? You don't. Introduce one food at a time and wait a while to make sure the baby can tolerate it so that if he or she can't, you know what the offensive food is. We start with rice, and then there's a progression of different grain cereals that you can move on to once you're sure that the baby can tolerate it. When it comes to baby foods and weaning foods, okay, we do want to give iron-fortified cereals, okay, but what we don't want to do is ever feed baby food desserts. If you walk through the baby food aisle of your grocery store, you will see baby food desserts. And think about that. Okay, there's absolutely no place in a 6-month-old baby's diet for dessert products like apple pie. Okay, and some of them have kind of fruit-based approaches to them, but if you look at the ingredients, they're pure sugar. You definitely don't want to get kids used to or developing an affinity for those really sweet foods. They'll never go back to eating vegetables or grains or meats which aren't sweet again. We're not naturally born with an affinity for sweetness. It's developed. So we really want to delay introducing sweet foods to kids until much later in childhood. Otherwise, they're much less likely to go with trying to eat the non-sweet foods. And some parents will also always introduce vegetables before they introduce fruits when it comes to baby foods. As you give your kids some pureed apples or bananas, that's much sweeter than broccoli or peas. And kids know, especially the ones that have very good eyesight, if it's green and coming at them, they turn their head because they know that the green ones are never going to be sweet. So a lot of parents will wait longer to introduce fruits. And then there's other parents there's different studies that show that introducing fruits for some reasons can be healthier than vegetables. But the point is you never give a sugar-sweetened dessert to a kid. When it comes to vitamin C, remember that vitamin C enhances iron absorption. We're really concerned about kids' iron intake. You hear that over and over again when you study childhood nutrition. Okay? Iron is so important because of cognitive development. Okay? That's what helps the baby's brains develop and stay sharp, in addition to the fat that they get in their diet. If a kid is iron deficient, he suffers cognitively and will not be able to learn as effectively as a kid with good iron stores. So if you can give vitamin C containing foods alongside iron containing foods, it will only help the baby absorb more of that iron. When it comes to the bottle, okay, it's advisable not to put babies into a bottle with a crib. Now, some parents will do it. Okay, for the most part, the recommendation against putting a baby to bed with a bottle is that it's an aspiration or choking risk. Now, some parents have determined or they feel safe putting their baby to bed with a bottle knowing that they're not going to choke, which is their decision. Okay? But if you do, you should certainly never put a baby to bed, especially a baby that has teeth or is teething, with any carbohydrate-containing drink in it. That's milk and juice. So if you put a baby to bed for 8 hours and it's got a bottle that it can suck on or has the juice or milk sitting on its teeth, that carbohydrate can promote bacteria that lead to the degradation of the enamel and cause teeth problems for the kids. And so you see that baby bottle teeth decay. You can look up online and see really unpleasant pictures of baby bottle tooth decay. So you never put a kid to bed with a sugar-containing beverage. And milk and juice both have sugar. Okay, even if you do 100% fruit juice, you guys know it has fructose, which is fruit sugar. The next slide is showing some of the infant development and recommended foods. Okay, this varies from kid to kid. So because each stage of development builds on the previous stage, the foods from an earlier stage continue to be included at all later stages. Okay, and then on the second column is showing the feeding skill, and the third is then which foods can be introduced into the diet. So from the period of 0 to 4 months, okay, the baby is turning its head towards any object that brushes its cheek. It initially swallows using the back of the tongue, and then gradually will begin to swallow using the front of the tongue. Okay, the baby will have a strong reflex, which is called the extrusion reflex, to push out food during the first 2 to 3 months. Okay, we don't give food to babies 2 to 3 months. They're usually just on breast milk or formula. Okay, so the foods introduced into the diet on the far right from 0 to 4 months, breastfed milk or infant formula. Now, this particular publication is saying from ages 4 to 6 months, it's okay to introduce food. Again, some parents do introduce it that early. Other parents prefer to wait until 6 months. It really depends upon the readiness of the child. Okay? As the child hits that 4 to 6 month, that extrusion reflex diminishes. Okay, so the kid is less likely to be spitting out and pushing out food, and the ability to swallow non-liquid foods develops. Okay, the kid will indicate a desire for food by opening his mouth and leaning forward, indicate satiety or disinterest by turning the head away or leaning back from food, so they're done eating. Okay, the baby should be able to sit erect with support at 6 months. It's important that you can sit upright for digestive anatomy. begins the chewing action, brings the hand to the mouth, and can grasp objects with the palm of the hand. Again, this is from ages 4 to 6 months. At this period, you begin iron-fortified cereal mixed with either breast milk, formula, or water, and then introduce pureed meats, legumes, vegetables, and fruits. Note that there's no baby food desserts on that list. From ages 6 to 8 months, the baby starts to be able to feed his or herself with fingers, develops a pincher grasp, which is finger to thumb grasp, and begins to drink from a cup. So at this point, the parents introduce textured vegetables and fruit and can begin plain, unsweetened fruit juices from cups. Usually parents will dilute the juices with water. Juices are very hyper-concentrated, hyperosmolar source of sugar. Even if it's 100% fruit sugar, oftentimes can lead to diarrhea in kids if it's not diluted, especially apple juice. From months 8 to 10, the kid can start to hold its own bottle, reach for and grasp food and spoon, and sit unsupported. Okay, so then at this stage, the kid can begin eating breads and cereals from the table, starting on yogurt, pieces of soft cooked vegetables and fruit from the table, and then gradually begin finely cut meats, fish, casserole, cheese, eggs, and legumes. From the ages of 10 to 12 months, the baby may begin to master the spoon, but of course will still spill things. And then the parents should be encouraged to add variety, gradually increasing the portion sizes. And usually by age 1 of life, the baby should be eating very similar foods to what the parents are eating. When we learn about child nutrition in the next module, you'll see that the childhood feeding specialists recommend that you don't short order cook for your kids. Okay, if they get in the habit of being able to ask for or eat whatever they want and not what you're eating as adults, it develops more picky eaters. Okay, and so what kids should be eating by 1 year of life is just smaller versions of whatever the parents are eating. A couple more slides here, just at the end. This is just showing you the comparison. I've kind of already covered this topic, but the calorie requirements. There's 2 ways to kind of understand calorie needs. On the left-hand side is total net calories, so the number of calories you eat in a day. We as adults need, somewhere around 2,000. Of course, an infant being much smaller only needs about 500 or 600. But if you compare on the right-hand side of the slide the calories per kilogram of body weight, this is where we see that big difference. The baby's needing 100 calories per kg, whereas adults only need 25. That's again because they're growing so rapidly during this period of life. Here we're seeing a comparison on the calorie distribution that infants get from human milk. So this is starting at 0 to 12 months or 6 months, depending upon how long you breastfeed for. And then the right-hand pie chart is the calorie distribution for adults. And we've already covered some of these concepts, but note how much higher the fat content of an infant's diet is. Almost 55% of the calories coming from fat. Remember, that high fat helps for brain development. And also, keep in mind that fat is the most nutrient-dense of the macronutrients, right? If you want to get bang for your buck with regards to what you eat a lot of fat because you get more than twice as many calories than if you eat carbs or protein. And so because the baby has such high needs during that first year of life to promote growth, that's why the percentage of calories from fat are so high. The last thing that we're going to talk about in this lecture is the USDA's, that's the United States Department of Agriculture's WIC program. Okay, and WIC stands for Women, Infant, and Children. The full name of the program is the Special Supplemental Nutrition Program for Women, Infants, and Children. Okay, but we abbreviate it WIC. Okay, WIC is an income-based nutrition assistance program. So it's a federally subsidized government program to help low-income women, infant, and children get vouchers that they can use to buy nutritious foods. This is very different from food stamps. Food stamps is also technically a nutrition assistance program. And we'll learn about food stamps later in the class. And you'll see that with your food stamp benefits, you could go to the grocery store, and you can buy regular soda and Snickers, and it really hasn't been proven to make anyone's life more nutritious. It's more of a financial assistance program. WIC is certainly a nutrition assistance program. Because with WIC, you can't take your WIC coupons and go into the store and buy just anything. You can only use WIC vouchers to buy certain nutritious foods, which I'll show you in the next slide. The people who qualify for WIC, they have to be income eligible. So you have to fall below a certain threshold for income eligibility guidelines. Okay, but there's a really startling statistic that half of all babies born in the United States are born to WIC eligible families. Now, not everyone's participating, but if you think about that, okay, half the babies born could be receiving or are receiving benefits from this program. It's a massive program. It's administered at the state level, so it's a little bit different state by state. In Southern California, in San Diego, for example, the WIC program is administered by the San Diego State University Foundation. So they operate the different WIC branches. But you go to other counties, it can be run by the University of California. It can be run by the Public Health Department. It varies from county to county. But WIC is eligible or available in all 50 states. It serves low-income, pregnant, breastfeeding, non-breastfeeding postpartum. So that's after you've had the baby if you choose not to breastfeed or you can't. Infants and kids up to age 5 who are determined to be at nutrition risk. To be honest, if you meet the income eligibility guidelines, you are considered to be at nutrition risk. They usually will screen for your iron levels, or they'll do a food intake form. There's a lot of different ways to determine nutrition risk, but people who are low income almost always qualify. Okay. The WIC package had remained largely unchanged for decades. And then in 2009, there was the first package revision since 1980. And one of the biggest public health advocates for a long time had really complained about the amount of fruit juice that WIC gave. Okay, we know that kids don't need fruit juice. Okay, a little bit of fruit juice here and there is fine. But there were actually some interesting studies that showed that there's so many kids on WIC and there's so much fruit juice given out in WIC that the juice from WIC was actually a contributor to childhood obesity. That doesn't really make sense. This is a federal nutrition program that has a big component of it that may be contributing to obesity. So the biggest change in the 2009 package revision was that WIC recipients started receiving a lot less juice. And that was a good thing, because again, kids don't need as much juice as they were getting from WIC. What are the other foods that are included in WIC? Here's an example of what the WIC food package can include. It varies from state to state, so you'll find different foods available in WIC in Hawaii, for example, than you would in Alaska. Okay, but for the most part, the basics remain the same. Parents who are on WIC, okay, can go to the store and with the vouchers buy for the mom or for the kids 5 and under, infant formula or iron fortified infant formula and infant cereal. Okay, if you can't breastfeed or don't breastfeed, WIC is actually the largest purchaser of infant formula in the country. Okay? And one of the interesting things about the WIC program is that you have to do classes in order to get the benefit. With food stamps, you don't have to take any nutrition classes. Okay? And that's, to be honest, why people go and buy regular soda and Snickers, because they don't necessarily know that those aren't the most healthful foods. With WIC, in order to get your benefits, you do have to take classes. And there's all sorts of classes on things like how to breastfeed, how to shop on a budget, how to buy more nutritious foods, what are good snack foods for kids, what are the benefits of exercising. Lots of different classes you can take for WIC, but you have to participate in education in order to get the benefit. Okay, and that's why it's such a successful program. So there's actually an education component involved. Iron fortified adult cereals. Okay, so you can't go into WIC and just buy Cinnamon Toast Crunch. Okay, because that's not an iron fortified cereal. Plus it has too much sugar. There's special nutrition guidelines and there's only certain cereals. And sometimes if you look next to the price at the grocery store, you'll see WIC approved. You'll see the California WIC logo if you're in California. Okay, and it will say that I can buy those regular Cheerios from the yellow box, but you can't buy Honey Nuts. Okay, not enough iron and too much sugar. So you have to kind of learn which foods you can get from WIC, and part of the classes help you with that as well. To be honest, it's hard learning at first, but once the parents figure out and they buy the same foods week after week, it's really not that big of a deal. There still is vitamin C rich fruit or vegetable juice, eggs, milk, cheese, peanut butter, dried peas and beans, canned fish. If kids have allergies to formula, okay, if they're intolerant to milk or can't tolerate formula, then you can get a doctor's note and they can actually get special therapeutic like soy or rice-based formulas. Okay. Recently added in 2009, in addition to all the juice they took out, they made a lot of other positive changes to the package, which was they started adding soy-based drinks. We've talked about how so many people, especially African Americans and Asians, are more than 90% lactose intolerant. Okay, they're not going to go buy a bunch of milk with their WIC coupons, and so there's calcium-fortified soy drinks on there now, tofu, more fresh fruits and vegetables, baby foods, whole wheat breads, and other whole grains. Okay, there are some farmers markets locally that accept WIC benefits. WIC still uses coupons. They're trying to move towards the EBT program that food stamps uses. EBT stands for Electronic Benefits Transfer. When you go to check out at the grocery store and you swipe your card, it says, do you want to pay credit, debit, or EBT? EBT is for food stamps, okay? And it was developed in order to reduce stigma, so that if you go and check out, you're swiping a card if you're on food stamps or not, just like everyone else. Okay? Because there is definitely stigma attached with you're going through the line, You've got your coupons. Oh, you can't buy that cereal. You have to buy this cereal. And still having to turn the coupons in makes it clearly identifiable to everyone else that this person's on assistance. So eventually WIC is trying to move towards that same EBT process where your card gets loaded up with the coupons at the beginning of each month and then you can use them just like you would a debit or a credit card. WIC is an extremely successful program. Okay? It is probably the crowning jewel in all of nutrition assistance in the United States. Okay? Everybody loves WIC. Legislators love WIC. It gets approved every year or whenever it comes up for reapproval. You don't want to be the legislator who votes to take away money and nutritious food from women, infants, and children. Okay? Not only is it a feel-good program, but it's definitely been documented to be a very successful program. And because there's this education component, since the very beginning, WIC has done an excellent job of tracking data. So they have data to show that WIC reduces fetal deaths and infant mortality. It reduces the rates of low birth weight babies and increases the duration of pregnancy, which is what we want. We want that baby to stay in there for 38 or 40 weeks. We don't want preterm babies. So moms who are on WIC have better health care, have better nutrition, have better birth outcomes. It improves the growth of nutritionally at-risk kids. It reduces the incidence of iron deficiency anemia in kids, which is so important for their learning potential. It improves dietary intake of pregnant and postpartum women. And it improves weight gain rates in women when they're pregnant. Pregnant women in WIC get prenatal care quicker and better than maybe non-WIC participating women would. Children in WIC are more likely to have regular medical care and more up-to-date immunizations. WIC helps kids get ready for school. Children in WIC demonstrate improved intellectual development, and WIC significantly improves children's diet. One thing you don't see on there is that women who are on WIC breastfeed at higher rates than non-WIC. Okay, and this is a huge area of controversy because some people who think that the WIC program is too big will say, if this is such a great program, how come more non-WIC women breastfeed than WIC women? Okay? Now you're getting into the issue of, well, because there's low-income women who are on WIC and higher income, more well-educated women tend not to be on WIC. Okay? They tend to oftentimes understand the benefits of breastfeeding more than lower-income women, but also lower-income women oftentimes have to work 2 and 3 jobs, and it might not be conducive for them to breastfeed exclusively for 6 months or beyond that. So WIC certainly encourages breastfeeding. There's breastfeeding classes, there's lactation consultants and degree nutritionists there who can help you breastfeed, but they also are realistic about the fact that, listen, it's not easy to be low income and now you've got kids, and so if you need formula, we're going to help you out financially with it to help you free up some resources for other things. Again, WIC is a very successful program. It's the Women, Infant, and Children program. And so that concludes our lecture on nutrition during the first year of life.